RSSDI TV 2020 brought to you by Wokhart. I am Dr. Ruchi Shah, and on behalf of Wokhart RSSDI TV 2020, I welcome you all. I am glad to have with us today renowned diabetologist from Pune, Dr. Anjali Bhatt ma'am. Ma'am is a consultant endocrinologist, Endo Clinic, Pune. She has a rich clinical experience in managing diabetes patients. Welcome Dr. Anjali Bhatt to the show.
Hello.
So ma'am, based on your recent talk of a very important and interesting topic on insulin-free type 2 diabetes treatment, is it possible, desirable or harmful? We would first like to know from you, is the insulin-free treatment of type 2 diabetes desirable?
Yes, thank you Dr. Ruchi for having me here, and being able to discuss on such an important topic is really a pleasure. So your first question is very, very valid and has a very straight answer. That is insulin-free treatment of type 2 diabetes desirable? And the clear-cut answer to this question is yes. Because everything with insulin is difficult. From the manufacturing to storage to dispensing to the administration to the patient, the technique, the disposables, the cost, everything related to insulin is difficult. So insulin-free treatment for type 2 diabetes is not only desirable, but is a dream of every patient as well as a physician, is what I would like to say.
Thank you so much. So ma'am, the next question will be, is the insulin-free treatment of type 2 diabetes possible?
Okay, so before answering this question, Dr. Ruchi, I would like to ask you a question again. Now, what do you think is the most one single keyword of this topic? What is it?
So ma'am, I feel it is the insulin is the keyword.
Okay, so I would agree with you that insulin is the second most important word of this topic. And the first most important word that we all know, but often tend to forget is patient. Right? So the focus of treatment is not insulin, right? The focus of treatment is the patient. So let's see how we look at this insulin-free treatment possibility from the patient's perspective or from the patient's angle. Though we traditionally described diabetes into type 1 and type 2 diabetes, the recent classification, or I would say sub-classification by the Swedish Andes trial by Professor Group, told us that type 2 diabetes is actually an umbrella term, which includes many phenotypical and pathophysiological types of patients. Now, we know that type 1 is definitely a severe autoimmune disease with very severe insulin deficiency, and these patients just cannot do without insulin. But when it comes to type 2, there are 4 more classes that this classification has described. One is severe insulin deficient diabetes, severe insulin resistant diabetes, mild obesity related diabetes, and mild age related diabetes. So if you look at our patient from this angle, severe insulin deficient diabetes, these people will present with very low insulin secretion, poor metabolic control, and highest risk of complications in terms of retinopathy and neuropathy. And these are the patients who will probably not get well controlled without insulin. But let us look at the other 3 classes. Severe insulin resistant diabetes. These patients will present with no insulin deficiency, obesity, later age of onset, and increased risk of nephropathy and fatty liver, not neuropathy and retinopathy. Okay. Third is mild obesity related diabetes. In these patients, the patients are in these class, the patients are really obese, more than 30 BMI. And the diabetes onset is very early, as early as 15-20 years, right? And third is mild age-related diabetes, where the hyperglycemia is very mild and the onset is very late, after 50 or after 60 sometimes. So these are 3 classes of type 2 diabetes, which we think are type 2 diabetes, are probably of the categories where we can treat them without insulin. Because severe insulin resistant, we don't need insulin. Mild obesity related diabetes, we need lifestyle modification. And mild age related diabetes would probably not require insulin for hyperglycemia management. Now, if you look at what is the percentage of patients that fall into each category, so severe insulin deficient diabetes contributes to around 18% of the pool, and rest of it belongs to other 3 categories. So we can be safe if we say that around 70 to 80% of patients, which we call as type 2 diabetes, insulin-free treatment is possible.
Thank you so much, ma'am. So, ma'am, the last question, is the insulin-free treatment of type 2 diabetes harmful?
Right. So again, we would look at this question also from this category point of view. Insulin deficient diabetes, the harms of insulin can only be hypoglycemia and weight gain. That also if it is used inappropriately. If you use in the correct dose with the correct regimen, which can either be basal bolus, basal plus, pre-mix, or only basal, whatever. So if you use the correct regimen and correct dose, it is not harmful. It is not the insulin which is harmful. It is the choice of a patient to whom you are giving insulin which can be harmful. So in a correctly chosen patient, in a correctly chosen dose, and in a correctly chosen regimen, insulin is not at all harmful. Neither hypoglycemia nor weight gain happens if we choose these three things correctly. Correct patient, correct regimen, and correct dose. So insulin is not harmful. But if you are using insulin in somebody who is already insulin resistant and in a hyperinsulinemic phase, giving insulin is definitely going to be harmful. It might cause hypoglycemia, it might cause weight gain, and most importantly, what it will cause is chronic inflammation, because we know that hyperinsulinemia is an inflammatory factor in the body and can lead to further complications like water retention, um, weight gain, fat gain, because it's an anabolic hormone. So in an inappropriately chosen patient, insulin can definitely be harmful, but it is not the fault of insulin, I would like to say again.
Thank you so much, ma'am, for sharing your views and throwing the light and precisely and explicitly explaining this problem and about the insulin-free diabetes treatment. And stay tuned to RSSDI TV 2020, brought to you by WOCAT, for more recent updates from RSSDI 2020. Thank you very much.
Thank you.